Hello everyone. Today we will be going to start with a new subject, that is anatomy. Whenever these new students enter into the first year MBBS, they all start with this subject, and everyone thinks that this subject is a bit scary, but trust me, it is not. Yeah, I can accept that it is volatile, but you have to keep it revising and revising. If you treat anatomy like a puzzle, human body like a puzzle, you will be amazed to see that it is very easy to remember all the stuff. So the first question that arises in our mind, what is anatomy? So the word is derived from a Greek origin. In Greek, anatomy is just to cut. The original word is anatome, and this word anatomy is derived from the same word. After that, you can just compare anatomy and physiology as geography and history. Like you can imagine this anatomy as a battlefield and history as a battle, which is physiology. So, whatever the physiological processes are there, so they start occurring on a specific field, and that field is the anatomy. So, what are the physiological processes that are occurring? So, basically there is blood circulation which is occurring. Where is it occurring? It is occurring in the blood vessels in the heart. So, the blood vessels on the heart are the anatomical structures, but the process that is occurring, that is physiology, just like geography and history, where geography is the battlefield and history is the battle occurring on the field. So this is how we can compare anatomy and physiology in a very comprehensive way. So now you have understand what is anatomy. So we'll move on to what are the types of anatomy. So basically you will get two types of anatomy, that is macroscopic anatomy and microscopic anatomy. Macroscopic anatomy is also called as gross anatomy. Macro means big structures and micro means small structures. That is just a common sense. In microscopic anatomy, you will basically learn cadaveric anatomy. All the structures what you have been learning, you will learn it on cadaver. Cadaver is just a dead human body. We should have immense respect for that because it is teaching us a lot of things. This cadaver is stored in formalin to prevent putrefaction. Putrefaction is just decomposition. So to prevent decomposition, we will remove all the blood from the blood vessels and we will start injecting formalin inside the human body, which will keep it preserved. And after when it gets preserved, we will just dissect each part. We will see the epithelium, we will see the fascia, we will appreciate the muscles, the bones, the cartilage, and this is how we will going to be learning this cadaveric anatomy. And there are two methods where we can learn this cadaveric anatomy. First is the regional method, and second is the systematic method. So in regional anatomy, you will be just learning it region by region, like the upper limb, thorax, abdomen, lower limb, head, neck, face, neuroanatomy. So these are just regions. Like if I take a region such as upper limb, so in upper limb you will learn everything. You will learn the bones of upper limb. You will learn the muscles of upper limb. You will learn the nerves. You will learn the blood vessels. So but what basically happens different in systematic anatomy, you will learn each part systematically. Like if you start a system such as the skeletal system, so you will learn each bone of the body. So that is the whole system you have learned. Second, if you start a muscular system, you will learn all the muscles, the structure of muscles, the function of muscles, the attachment of muscles. So that will be different in systematic anatomy. Now we will be moving on to the second type of gross anatomy, that is embryology or embryological anatomy. In that, you will learn all the prenatals and postnatal phases of the human body. So you will learn all the structures, how it formed, how it is developed. You will all learn all the developmental phase in the embryonic development. And basically, the students who know embryology very well, they will be becoming good gynecologist, good pediatrics, becoming all the anatomical structures, all the physiological processes by your own. So you'll be better at diagnosis if you know embryology. After embryology, we have third type, that is comparative anatomy. In comparative anatomy, we will basically use the anthropological view. In anthropological view, we will just compare our ancestors or other animals with human body. You can check it as we are standing on 2 feet, we became bipedal because of the evolution. So if we start comparing our anatomy with the animals such as monkeys, you will get to see the similarities because we share anthropological anatomy. So this is another type of anatomy, and after that you will see topographic anatomy. What is topographic anatomy? Here you can just appreciate the structures which are present inside the human body by seeing the surface of the human body. For example, if you want to see the position of heart from the surface, you can appreciate it. After dissection you have seen, okay, the heart is situated from second rib to sixth rib. So whenever you will see a human body, you can basically, from the surface, you can be able to identify that the structure of heart is situated between the second rib and the sixth rib. So this is how you use a topographical anatomy. Basically, you will learn this all topographical anatomy in the surgery. In surgery, you will have a special book for this topographic anatomy. After topographical anatomy, you will basically have applied anatomy, or it is also called as clinical anatomy. Here, you will just see what are the symptoms occurring inside a human body. You have basically seen the normal functioning, normal structures present, but now you will be applying all these things. You have seen normal structure. If a patient came to you and he is telling you that, okay, I have this abnormality, that abnormality, by seeing you can tell and you can apply your knowledge. Basically, this clinical anatomy and clinical physiology as well, you will learn this in medicine. That is the core part present there. After this applied anatomy, you basically have radiological anatomy. In radiological anatomy, you will see all the structures of bones, muscles. You have different types of X-rays. In first year, you will just see the normal structures because for knowing abnormal, first you should learn the normal structures. After seeing all the normal structures, when you will go to orthopedics, when you will be learning orthopedics in the third year, you will see the abnormal structures like you can appreciate the scapula, you can appreciate the humerus bone. But when you will go in third year, you will find a fracture there, and you will see in orthopedics that okay, the normal structures was like this, and this is the abnormality that has been occurring here. So this is all about the microscopic anatomy that we have discussed here. After that, we want the microscopic anatomy. In microscopic anatomy, basically you all will see the histological structures, the microscopic structures, the microscopic structures of bones, muscles, epithelium. There are different stains used in these structures for just identifying what is present there. And basically, these are all the normal structures you have been learning in anatomy, and normal processes you will learn in physiology. But if you see any abnormalities, the abnormal structures, you will be learning the abnormal structures in pathology. In second year, that is paraclinical subject, you will be learning all the abnormal structures there, because the definition of pathology is in such a way that if there is any abnormalities in structures or abnormalities in function, then it will be referred to as pathology. So you'll be learning all this there. And about the books, whichever you should use for this anatomy in first year MBBS prof, you should basically refer to BD Chaurasia, the 4 volumes, or Vishram Singh you can take, and a handbook as well for just knowing all the general stuff. And just don't try to jump on Grey's Anatomy, because I know first year students are very enthusiastic. They will just try to get more and more knowledge. But I'll tell you the reality that the MBBS syllabus is so vast that if you try to complete whole syllabus in your whole lifetime, you won't be able to recover from it. So basically start from BD Chaurasia, Vishram Singh. You can go to Grey's Anatomy when you have a lot of time or you have completed your degree. Or else, if you have more curiosity, you can go to this student version of Grey's Anatomy if you want to read it. After reading these 4 volumes, you have basically completed the gross anatomical part, which is microscopic anatomy. Not completely, because you have to learn all the radiological features, all the topographical features, and clinical features that you will be learning in third year in medicine and in radiology, etc., etc. Apart from this, you can use book for histology and embryology as well. You can use Neeta Kulkarni's book because I am the one who is using the same book for as a reference. And this is all about what we have discussed here in this introductory part of lecture. So I will just be posting schedule for next lectures in 2 to 3 days. We will be completing with general anatomy. Then we will move on to upper limb, lower limb, thorax, abdomen, and neuroanatomy, head, neck, face. I was thinking that we should start with head, neck, face, and neuroanatomy in the first instance. But let's see, I will post the timetable in 2 to 3 days. And that's it. Thanks for watching. See you in next lecture.